First up at 11, developing news on the ongoing coronavirus outbreak.
Something that is now community transmission. We're in it, people, right? So here we go.
For the second day in a row, the state confirms an employee of a Connecticut hospital has the coronavirus. Tonight, it's a Bridgeport Hospital physician. Thank you for joining us for Eyewitness News at 11. I'm Kara Sundlin, and last night, it was an employee who worked at Danbury and Norwalk hospitals. On a night where it appears the coronavirus is inching closer, let's go live right now to Channel 3's Matthew Campbell. He is live in our newsroom with the latest numbers from our state. Matthew?
Well, Kara, so far 21 patients in Connecticut have been tested. None of them have it, but even at today's announcement, officials are saying it's only a matter of time.
The coronavirus comes as close as it can to Connecticut without actually crossing our borders.
One of our community physicians who cares for many patients at our hospital was found to be positive for this virus.
A physician at Bridgeport Hospital who lives in Westchester County, New York, is confirmed to have the virus. The patients he treated, officials say, also from Westchester County. Officials say the physician was working in Connecticut as recently as last weekend.
At that time was not symptomatic at all. He was not feeling ill.
Last night, the New York State Department of Health let Bridgeport Hospital know he had the coronavirus. Out of an abundance of caution, the small number of patients were self-quarantined.
The Center for Disease Control is now advising us that such an isolation is not necessary at this time.
Bridgeport Hospital's president explains why.
That is because the physician did not have symptoms while he was here at Bridgeport Hospital.
Right now, the state has tested 21 patients for the coronavirus, all tests coming back negative. 9 tests are still out, and some of them are connected to last night's announcement that one employee who works at both Danbury and Norwalk hospitals got the coronavirus.
As we speak, 9 patients that are being tested, their specimens are being tested. 3 of those are from the Norwalk-Danbury situation from last night, and then there's the one from the Bridgeport Hospital.
Also new tonight, more test kits are coming. Each kit can test up to 600 people, and more will arrive early next week. But Senator Blumenthal says it's still days late.
We were promised that tests would be available, 1 million of them, by the end of the week. They are still nowhere to be found in Connecticut.
Meanwhile, private labs will begin testing next week, and that should ease up on the strict criteria the state currently has. Last night in Danbury, we pulled aside a spokesperson from the DPH and asked, since there are just a limited amount of tests, how does one get one? They say the patient needs to be hospitalized with symptoms and have a doctor rule out the flu or pneumonia. So, Kara, another thing we took away from today's news conference is the urgent tone coming from the state about how important it is to stay safe by avoiding contact. And you're going to see this right here at Hartford Hospital. This is how President and CEO Jeffrey Flax and the Surgeon General greeted each other. That skin-to-skin contact, that is being avoided at all costs. Listen to the urgency in the commissioner's voice as she describes what should be the new rules going forward.
No touching with your nose, your mouth, your eyes. I ask that people from now on do the elbow bump, not even the fist bump, the elbow bump. And it's very important. It really is, because transmission is quite high.
That's the latest. Live in the newsroom, Matthew Campbell, Channel 3 News.